Good morning from Los Angeles, California, home of the Dodgers, the Lakers, the Trojans, the Bruins, Hollywood, and the Full Breath Solution. I'm Dr. Bryan Keropian, and we're shooting this video to show you how it can be more effective in your hands. When the Full Breath Solution is seated, it's different than all the advancers. One, we do absolutely no advancing of the mandible. And two, we control the tongue. Whereas the advancers pull the jaw forward, trying to pull the tongue forward. We utilize this, what we call either translingual or transpalatal bar, to control and inhibit the tongue. And then we put a little tail that we expand, and then we push down. Very similar to the MD's tongue blade that pushes the tongue down so he can see the airway. Well, we're going to keep the airway open with this. Let's take a look at what do we do for the 90% that can tolerate the full breath with the tail. Because that's what we're going to be doing over and over and over again. Well, after giving them 1 week to wear it. Now, why do we give them 1 week? We want them to become acclimated and used to it, and it's comfortable and it's part of them before we start making additions to the tail. I've learned that if you have them wear it for the 1 week, the rest of the way goes easy. You can add to it without causing problems. So now we're ready to add to this. Well, look, we're going to be smart. We're going to add wax first. Because wax, by putting what we want on with wax, if they're uncomfortable, we know it, we can take it off easily, or even cut the wax in half. So we use periphery wax. There's numerous brands on the market, but you can go to any one of your dental supply companies and get the periphery wax. And here's what it looks like. This is what you put around an impression tray to extend the impression tray. And so I am going to take a small amount. Here I go. And we're going to take it right here to the tail, and we're going to put it right on here. It sticks really well, because everyone's worried, oh, it's going to fall off and go down their throat. No way, Jose. It's hanging in there. And there it is. And that, you see, I've extended the width a little bit, and I've extended the length. Give them a little feel for what's going on. All right, now we're going to do step 2 of the first addition, and that's to take some more of this wax, and watch what I'm going to do. I'm going to fold it 3 times. There it is. I folded it 3 times, and then we're going to cut it off right here and place it right back, and look what we have. On the underside, the inferior of the tail, we've made it thicker. We're starting the depression. Here's what it looks like from the inferior, the 3 bars. And here's what it looks like from the side, the 3 bars. We've added the wax, both the length and inferior. I like to put it in the hot water. It just makes the wax easier to work with, and now all I'm going to do is just kind of spread it out, and there we go. Let's look at it from the side. Let's look at it from the back, and we'll look at it inferiorly. There it is. Now we try this in the mouth again. Oh, he likes it. No problem. Now, you can see here the acrylic. The liquid is purple, and then the powder. And utilizing this that you can get from Space Maintainers, the acrylic will come out the same color as the body of the appliance. So it won't look like something Mickey Moused or added. I highly recommend you order the acrylic that is with the purple monomer from Space Maintainers. Alright, so let's start our mixing. Alright, here I am mixing up the acrylic. We've removed the wax. We remember what it looked like. Now this, we are not going to add this on exactly, but it's going to be close. This is not a 3/4 crown that everything's got to be exact. So it's going to be a millimeter or half a millimeter too long, a half a millimeter too short, half a millimeter too high, too low. Alright, so here we've got the acrylic mixed. We're going to be placing it on the inferior of the tail. Only on the tail. We're not going across the whole bar. This kind of looks like the way the wax was. And we can see on the back how we approximated how thick the wax was there. And we can see that we've come down. It's about the same way we were. And so now we're going to let this harden up. And then we're going to go take it over to both the lathe and the handpiece. Get this smoothed up. You are going to see me working on the superior portion of the tail. And now I am taking it, we are going to make it thinner. So it's not going to be so thick. And you can see already it's going to be taking a step down. Alright, I added some acrylic at the inferior, at the end where it tended to come up. And as we look at this right now, we see that the inferior of the tail is parallel to the occlusal plane. Beautiful. That's step one. We're going to be doing that. And we're also going to notice this is pretty symmetrical. It's not perfectly symmetrical, but it's pretty symmetrical. Pretty rounded. So we got to take heed of that because the patients are very aware, and I have found out, if it's leaning to one side just a little bit. They pick that up and come back, and they will give you that. Now, on the other hand, I also have rounded all these corners here and here, down here, up here, back here. You've got to make sure those are rounded, those are polished. If you want to use a rubber wheel with it as well, great. But here we are. First adjustment. We've added to the tail in length and depression. So now we're going to try it in the mouth, and the patient says, great. Now, we send them home, and I send them home for 2 weeks with this. So the first time I send them home, where we first insert the mouthpiece, they get sent home for 1 week. Now they've come back, we've added the wax and the acrylic, and here we are. And now we're going to send them home for 2 weeks. And they're going to come back with, some of them are going to come back and tell me this is bothering them. Small percentage though, very, very small percentage. Well, we have to make it smaller, lift it up. Some we have to even make it really small. And then play the game all over again. Well, you know how to play the game now. Playing the game is adding more acrylic. Well, you know how to do that. You know how to add the acrylic, let it harden, trim it at the lathe, trim it with the handpiece, polish it. Piece of cake. All right. Send them home for 2 weeks. They come back. Yeah, I'm doing pretty good. I can handle it. My snoring is down just a little bit, but I am still snoring. Well, we need to do some more expansion of the tail. So guess what we go back to? Our old friends, the beading wax. And let me take some beading wax out. And here we go. I'm adding more. Now the question is, how long are we going to make this tail? And this is something that I didn't get for a long time, and I just used to kind of play around with it, whatever it was, and that's what I did, however they felt. But let's examine this. Someone has a short tongue from here to here, and we put this in. We are almost all the way back to where the tongue ends and curves down, and here's the uvula right back here. Well, we're not going to be able to go a heck of a lot longer than that. But where I really lost it and have found that this is where we're going to win the game is, we get people with a, say, a medium-sized tongue, not all the way here, but to here. So this may be the short of the back. Well, I want you to take a good look at that. Well, how are you going to look at that? Well, you're going to get your mouth mirror, and you're going to put your mouth mirror in and see where this is. How much space is there back behind here? There may be a quarter, there may be a half an inch, shockingly. And if we're going to add, I like to add parallel to the surface of the tongue. So I add across. Now, if it's a short tongue, I'm going to add down. So if we're all the way to the back of the throat, right here, we're going to add and go down. We are going to depress the tongue. And we are going to open the airway with depression on a short tongue. Medium-sized tongue, we're going to go back. Now how about if it's a long tongue? And boy, I get some people with some long tongues, and I've made some tails that go back like this. Shockingly, absolutely shockingly to me, shockingly to other dentists, they just can't even believe it. But one of the things we found out, the reason we snore is that the tongue goes back, and instead of closing the airway 100% and slamming it shut, it goes back 80% and leaves a little opening. And then that small opening, the air from the nose or the mouth comes down and rushes down, picks up speed. The Venturi and Bernoulli principles of physics, going from a large opening to a small opening, a fluid picks up speed, everything starts to vibrate, and we go, that's that. So, if we can stop, if we can open the airway and make it bigger instead of 20%, let's make it a 40, 50, 60% opening, we're not going to get the snoring, and that's why at that point we're ready to run another sleep test. But here we are. Small tongue, we're all the way back. What are we going to do? We're going to add it just the way we added it when we did it the first time. We're going to add some length, and then we're going to do our folds. We've got our 3 folds. We're going to add our wax on the back and the 3 folds. Oh boy, we are down. You can see we're down quite a bit. And well, we're a little short right there at the end, but we're going to add a little wax to it. And then we're going to go in and add the acrylic the same way we did the first time you saw. You know how to do that. Take this off, add the acrylic, let it harden, trim it, smooth it, polish it. All right, but now let's take a look at the guy with the longer tongue. Because with the longer tongue, we don't want to just depress right here. We really got to depress a little farther back. So if we depress here, we're probably not going to win. So we're going to want to add, we have to know and see where this is. Now, one of the things I will do sometimes is shave this down, this curve right up here. Shave this down. Now, if I do that, I want you to take good note of this. Right here, in the 2 corners, I add a little bit of wet acrylic and thicken it up so that this is better attached and stronger. Because if we do some taking this down, this thins. So, if you want a better view of the back, you shave it down here in a curve it down, add some acrylic here for strength, polish it, and now you got a better view. Or you use your mouth mirror to see where are we, how far back. But I want to get back here. So and remember I said we're going to not depress yet, but we're going to lay it on right on the top of the tongue, just covering it but going back. You know, there's minimal depression. I mean, it's not like there's no depression, but there will be some minimal depression. And here's that tongue again, and wow, we're back even more. But we may have to stop here. That's all I can tolerate. We're now going to go back and add acrylic again. This will now be longer. Trim it, and now the tail will go all the way back here. Now, if they come back in 2 weeks, we're going to give them 2 weeks, and they say, well, I'm still snoring some. At that point, we've got one of two choices. Well, one of three choices. One choice is we can add wax, do the same thing, and add it all the way from front to back. And we depress the tongue some more. We now take this to the lab. We try it in the mouth. It's comfy. They can take it. We've taken steps. And we'll get everything from this is too long to this is too much down here. Well, we make it smaller. You're bright. They tell you that yeah, the last thing you added is too much. You make it smaller. And we go ahead and we now enlarge the tail. And we're going to also come down because we don't want the tail this thick. We want it long and thin. The same way this is thin, we want this to be thin. And the only way you're going to do that is after you've squared it all the way, is cut it from the top all the way back. So you're going to have a long step back, a long bayonet. Now, one of the other things that can be done at this point, if they're still snoring and there's still a problem, we can extend backwards. And I have found these are two things that work real well. I have had some people that just, no matter what I did, I couldn't stop. But once I found the secret of following the tongue as far back, and that was the shocking revelation to me. We can follow the tongue all the way back by keeping the acrylic right on top without shoving down too much. And what does that do? When the tongue wants to go up and back, it restrains and inhibits. And boy, are we able to win the snoring on the tough cases. So the first thing we're going to do is if someone says, I can't swallow, that's too much in there, or I am getting too much saliva, we are going to cut this tail off. We're going to go right over. You can do it with a handpiece, or you can do it with the lathe. You take it over, you put it on, you cut it off, and there it is straight across. rounding off the two. You got to make sure this is real smooth now, because it'll bother them if it's not smooth. And we're going to polish this up where we had just cut that off. Oh, here we go. We've cut the tail off. We try it in, and the patient's comfortable. Well, now we want to send them home for 1 week. And this 1 week with no tail like this is for them to accommodate, to get used to having something in their mouth. Because in a week, we're going to add a little more tail to this. We tried it in, the patient could wear it, and we sent him home. But what happens if we put this in and the patient still says, oh no, too much pressure, I can't swallow, I'm getting too much saliva? Well, at that point, we are going to rough up the top here, add some acrylic up on top, and then we are going to remove it from the bottom, and we are going to increase this arch upward away from the tongue. And we are going to create more space for the tongue. All right, we are now ready to start adding acrylic on the superior portion of the translingual bar. We're going to raise it up. All right, we've mixed the acrylic and we've let it set up a little bit. And here it is. And we'll start placing it right on top of the bar. And you can see what I'm doing right here. You can see what I've created. As a matter of fact, one of the things we like to do sometimes is put a drop or two on here. Yes. And there we go. And that'll really give us a much smoother finish on top. And now I'm going to put it in the hot water. If you have a water bath, or you get a green bowl with hot water, it will accelerate the set. And then I'm going to take it into the lab and I'm going to smooth it, and I'm going to remove acrylic from the inferior. I'm going to remove acrylic from here to make the curve go higher. We've trimmed off some of it here so it's nice and smooth. Big thing is though, we've raised the bar to take it away from the tongue. Now at this point, I'm going to take it over to the small handpiece. We're going to do a little finessing because this has got to be smooth, smooth, smooth. Now we said that about 10% of the patients have a problem with the tail, with the bar. So for that 10% now, we've elevated the bar. Of that 10%, this will eliminate the sensitivity in 90% of those people. And you're going to have 1 or 2 every 3 or 4 months that they're still bothered. And if that's the case, then you need to cut the bar off here and cut the bar off here. So then what are you going to be left with? A bruxism appliance. No bar. So you add 1 more layer of acrylic on the translingual bar, raise that. It's still bothering them. Well, then you cut it. And now you've got that bruxism appliance. And you let them wear that for 3 weeks. Our next steps are we're going to do this the other way around. All right. We've got the high vaulted bar, or let's just say this. We want to go back down. What are we going to do? We're going to add the acrylic on the bottom. And we're going to make it thicker this way and take some away from the top. Reduce the top. And so we lower the bar. And once we've got the bar back or close to where we were, we're going to be ready to think about adding the tail. Well, I got to tell you, I really enjoyed doing this. You got my number for the full breath on this video. You've also got the number for Space Maintainers. You can certainly contact either Scott Weiss or John Christian. Those are the two head guys. Scott Weiss handles all the administrative stuff with Space Maintainers. John Christian is probably the top sleep lab man in the country, which makes it in the world. And boy, will he give you direction on what to do. You can contact me, and if need be, we'll get you my cell phone number, and you'll be able to contact me as well. All right, everybody, I enjoyed it, and I look forward to hearing from you. All right.